This is Daniela. She is my new med student with me. So I'm going to go through and tell her what I'm feeling so she kind of knows, because most of my students are MDs, so they don't get a lot of work with musculoskeletal type things. So like when she's seeing me do stuff, she's not entirely sure like what I'm feeling. So it's easier for me to show them on them so they kind of know what I'm doing. So generally when I start, like you see me push up here, right? And this, you know, this is in your spine. So what I'm pushing right here is your first rib, because your rib comes up this high. If you look at a skeleton, you'll see it. So you have an elevated first rib on your left. Can you feel how
Definitely
it
feel that, yeah.
how it feels more painful? So then this is when you're finding the spinous process. So here's your spinous process, and it kind of dips down. Do you feel how it's kind of like dipping down with my thumbs?
Yes.
So I essentially call that a gutter space. So I am feeling into the transverse processes, and so I'm kind of just walking down, and I'm not putting a lot of pressure, but I can feel that there's a lot more tension on this left side compared to your right side.
I feel it too.
Yeah. It's in your entire left side. Okay, so your iliac crest. Iliac crests are lower than I thought they were. So you feel that iliac crest there. So I bring it around to where your PSIS is. Okay, so you are going to, and so the other things I look at the positioning of your feet. So I see like your right foot is a little more turned out than your left is, and sometimes that can indicate a pelvic issue. So go ahead and lean forward for me like you're gonna touch your toes. Okay, and yours is definitely on your left side. Okay, come on up. Do you have back pain?
I have pain all over.
Okay, go ahead and lay on your back.
Yeah, Army for 7 years, so I just kind of
suck it up and get used to it?
Yeah, suck it up, drink water, ibuprofen, let's go.
So you have a superior hip on the side just like our last patient did. So I'm gonna do that pelvic thing you saw me do, kind of like that shotgun treatment. So I'm gonna have you push your knees in together. Okay, that click, that pop that you felt, that was your pelvis resetting. That's fine to have. Go ahead and push apart. And then push in. Good. And then go ahead and pull apart. And then go ahead and push in again. Good. And then go ahead and pull apart. Okay. Once you're straight out. Did the Army have you do stretching and yoga and stuff?
No.
Okay.
Oh,
They should. Push your knee up for me.
which knee?
This one. Hold my hands on. Good. Relax. And so I'm pushing down on your ASIS here, and then pushing down on your knee, and you're trying to lift up. And so I'm trying to kind of put that hip back where it's supposed to be. So go ahead and push up again. Good. And rotate out a little more. One more time. Good. The other reason I do this is so you can kind of feel the pressure that I use. Because generally when I have students do this, they kind of do a lot lighter pressure than what I would do. Okay, go ahead and actually show you something on the neck real quick. So when I have a person with neck or shoulder pain, I'm always checking motion in the neck. So rotate until a barrier point, rotate until a barrier point. And we're gonna side bend, and we're gonna side bend. And so, and when you see when I'm doing stuff in the neck, you see this when I'm here, but you can't actually tell what I'm doing. So I'm doing what's called translation. So I'm finding your spinous process, dropping over the transverse process, and I'm pushing back and forth like this. And I'm seeing if there's anything that feels abnormal. I'm actually gonna treat your first rib real quick. And then we'll move to your low back. Okay, so recheck definitely your left side. So, and this is something that you can definitely learn to do. Mira. So I'm gonna push you to your barrier point, which is right there. Did you feel that subtlety? Feels okay? Then it feels hurt. So this should feel more painful essentially. So this is okay, it's painful, bam, more painful. Okay, push your arm against my hand. And relax. And then go ahead and push again. Good. And relax. And then one more. And relax. Oh, that's better. So now when I'm pushing, does that hurt still?
No.
Good. Okay, turn over onto your stomach. So we're then gonna come feel all the things I felt in your back. Does that hurt?
No, it tickles.
Let's feel down here. Okay, so the myofascial release, what I was trying to show you. So it's definitely worse on this side. So this is the downward pressure I'm doing. Take a deep breath. And out. And you feel, as I let that deep breath go, you feel how I was able to like move down into the muscle, right?
Yep.
Yeah. Do it again. And out. Good. Okay. Breathe. Getting shallow breaths here. Is it harder? There we go. Okay. Did you feel that? Did you feel that muscle release at all?
I think so.
I should have warned you first. It's okay.
Yeah.
Okay, turn on your side towards me over here.
So I did have like cramps, and he just made them go away.
Oh, good. Where were your cramps at?
Like you
In
know,
your lower abdomen?
Yeah.
Okay, so I'm going to barrier point here. We're going to rotate to where you can rotate to. Push your butt back. You don't have the best extension in your back. Not for being as young as you are. Don't move yet. Okay, now push back. Good. Stop. Relax. Okay, go back onto your stomach. So with that, I'm just trying to get more movement in the spine. Let's see how this looks. Good. Strap your arms down. Let's go up here. That feels a little bit more even, but some kind of rib there that sucks it up for me. Put your feet that way, actually. Off the table. Yep. So your rib. So you definitely have a posterior rib right here. Okay, so I want you to go ahead and push your arm up. Good. And then I want you to go ahead and try and push it forward. Good, okay.
I felt that.
Try and push it up again. Good, and then forward. Good. That's better. Okay, stand up and see how that feels.
I'll feel later.